So now we discuss some of the health policies which have been implemented in Pakistan. The first one, we look at the health policy 2001. There have been many health policies before that, but let's start with some in 21st century and see how the health policy has fared over the years in the last 2 decades. So this was a policy made under General Musharraf. There were other reforms too, like for example local government reforms, and you will see the mention of local government reforms and other things within this policy. The main indicators and targets which this health policy looked at were that reducing infant mortality rate, which was 65 in 2004 and 55 in 2010, and then number of polio cases from 199 to nil in 2004 and nil in 2010. Then prevalence of malnutrition from 39% in 2000 to 20% in 2010. And then, of course, other areas, for example, lady health coverage from 45% to 100% in 2010. So these are the various targets which Health Policy 2001 set for itself. But of course, if you look at the situation now, the infant mortality rate is still 69, so it has not gone down much. The polio cases were 199 in 2000, and now they are 90 plus. For the last 2 years, they were, in single digits. So it was hoped that, polio will be eradicated completely. Pakistan is only one of the 2 countries in the world that has this, with Afghanistan, which has this large incidence of polio cases. But in this year, they have again surged. So we have failed in this area too. Then maternal mortality rate is again 140, which is one of the highest in South Asia. So what were the key issues, key features of health policy? So there are 3 key features of health policy. One was that health was considered part of poverty alleviation. So this was one where you see the shift from medical model of health to social model of health, because poverty impacts health. So if you are spending on health, you are actually spending on poverty too. So priority attention to primary and secondary sectors. So mostly because media is in urban areas and focus is on urban areas. So governments do focus on big hospitals and hospitals in urban areas and ignore the rural areas. So that bias which exists, this policy promised that this bias will be ended, and focus will be on primary and secondary health care. And good governance was the third feature of this health policy. So what are the different primary, secondary, and tertiary health care? So these we define these 3 cares based on severity of health changes. So primary care is your first contact with the doctor. You feel a problem, you go to a doctor. Usually he or she is an MBBS doctor. Usually he or she is closer to your home, whether it's in a basic health unit or a private clinic, but this is the doctor you go to. Then if your situation worsens, or if you don't consider that what the MBBS doctor has given to you, you then go to a better or more experienced doctor. So you go to a hospital and then, for example, a district headquarter hospital. And then lastly, if you still feel that your diagnosis is not right, or you are not doing well, you go to specialist and tertiary hospitals, specialist hospitals and specialist doctors who are dealing with your own concern. So the focus now in this policy was on early detection and early diagnosis rather than coming to the tertiary hospitals or specialized care. The overall vision of this policy was that health for all. So the issue was, the aim was that every person in Pakistan should be provided good health facilities. The 10 specific areas of reform were reducing communicable diseases, and these are the diseases which results in most of deaths in Pakistan, addressing inadequacies in primary health services, removing managerial deficiencies in the district health system, promoting gender equality, bridging basic nutrition gaps. If you have better fed children, you have better population, healthy population. Introducing required regulation in private medical sectors, so regulating medical colleges and medical clinics, creating mass awareness, improving drug sector, so reducing their prices or at least regulating the drug prices or essential drug prices. So, and reviewing as we discussed before, the urban bias in health sector. So governments tend to focus more or spend more on the health sector in urban areas, which should have been changed. And then, of course, the capacity building of health policy monitoring. So if you don't have data, if you don't have monitoring, you don't know whether you are succeeding or failing. So this policy focused on increasing or improving the health policy monitoring. Thank you.